the most common misdiagnosed or inappropriately supplemented is iron. And I think iron is toxic. And iron builds up in your liver. And it's the number one problem that I see, that people are told they're anemic, or they are iron deficient. But in whatever manner it's looked at, they are told they don't have enough iron. And I think that is brutally incorrect. And there's very effective ways to test it. It just doesn't fit within the framework of most medical approaches. So if there was one kind of supplement or correction that I would make with iron supplementation is the one that I've developed, in which I do have you take iron initially, and then I wean you off the iron and I move you to copper, which you absolutely need. You need copper and you need vitamin A. And so, as our prior discussion where I said D3, magnesium, K2, diabetes, obesity, if you are told that you are anemic, if you are told that you have thyroidism or hypothyroid, anyone that has hypothyroid, that your thyroid is not working well, will generally not have iron, and vice versa. So, but it's not that you don't have enough iron, it's that your body can't do anything with the iron. And to move iron is life. Iron is oxygen, right? You cannot live without oxygen. Iron is energy. It metabolizes and moves energy and oxygen, right? So the whole medical community literally throws the kitchen sink of iron at people, throws it at them. And when I say patients are coming to me chronic, I'm talking 20 years, 30, like their whole life. Since they were teenagers, they're like old people now. And I would say, okay, let's do the math here. I'm throwing iron at you at high levels, and it never works. You do your blood test, your iron is always low. You always feel like crap. Your hair is falling out. Your skin is flaking. You want to take a nap. You got to go to bed by 6. You bruise easily. You're just a mess. So I come in. I say, okay, no problem. I look at your diet. Your diet sucks. There's no meat in it, usually. So I fix that. I get So as I'm fixing the protein intake, I give you a little bit of heme iron. Now, I'm not going to tell you how much because that's proprietary. So I give you heme iron, the proper iron. In the medical community, they give you plant iron, which is garbage, makes you constipated, which means the patient is not adherent. They don't follow through. And then I bring in copper. Copper makes the iron work. There's something called seroplasm. So the copper activates the iron and moves it. Almost everyone has tons of iron in them. They just don't know it. And when I do a blood test, I test, if it's your medical doctor, he will test ferritin. And ferritin tells me what your storage is. But who cares what your storage is? Your storage doesn't tell me how much iron you got right now. If you and me have to run from here to the corner, I don't care what's in your storage. I care what you got right, what's in your pocket, what's in
going to
your
get us
blood.
there?
Yeah, man. So they don't even check the right thing, but they check ferritin because it's cheap. It's very cheap. And someone along the way said, check the ferritin. So we make all our decisions on what I would call. So I'm trying to figure out your finances of today by checking your investments that aren't going to come to fruition for years, right? I'm looking at your long-term savings to determine how you're doing today, right? And so the iron that they check is not even the right one. The one I check is your serum iron. I check to see what's in your blood, how much cash you got on you now. And then I check the protein that moves the iron to make it happen. And then I check how much of that protein you're using, how saturated you are. So it's basically, I look at your iron and I say, what's your long-term savings? What's your cash on hand? How much credit do you have? And how much of that credit are you using? Your average doctor, and I don't know if you've run into this already, is not doing an iron study. They just do your ferritin. So I give them the heme for 30 days, and then I give them the copper, and I introduce 10,000 IUs of vitamin A. The vitamin A makes the copper work. So see, each one has a job. I have not run into a doctor yet, and I'm giving away information right now, and that's okay. It's 11 milligrams of heme iron. Um,
That
but
intellectual property is disappearing.
it's all good. It's all good because you still need me to make it work. So, um, anyways, if your energy drops and you still bruise, then I know it's some iron. Like we have to keep the iron up. But if your energy doesn't change once I get you off the iron, then it proves my argument that you are never iron deficient. You were deficient in ability to move iron, to move energy and oxygen. And then that's the biggest supplemental change that I do.
If that video touched your heart and you got value out of it and you want to hear another piece, click here. If you want to watch the full episode and hear the whole story, click here.